irritating. Okay. Liver stuff, part 2. Okay, now let's talk about viral hepatitis. There are 5 kinds of hepatitis that you need to know about. Your book talks about 6 of them. The last one you're not going to need to know about. And really, the 5th one is very rare. So, these are the ones that you need to know about. Hepatitis A, B, C, D, and E. Now, this is what you need to know. They are viruses. So we treat them like a virus. Bacteria, like antibiotics, are not going to be really effective. We do have some antiviral medications that work in some in some of them that we'll talk about. But what happens in each of these cases is it is a virus that attacks the liver. Hepatitis A and E are they are obtained through oral fecal routes. They are very common they're more common in developing countries where sanitation is not what it is in the United States. So the hepatitis A and E happen when feces or something that has been contaminated with feces gets ingested. So these are the viruses, the hepatitis that you see in cafeterias where some cafeteria worker went to the bathroom, didn't wash their hands afterwards, and then started working with food, and a lot of people consumed that food. Then you'll have an outbreak of hepatitis A or E. So you can only get that through fecal oral routes, eating contaminated food, drinking contaminated water, things like that will cause hepatitis A or E. Hepatitis B and C are the high-risk lifestyle activities, and specifically like IV drug abuse, blood infusions that were before 88 or 92, back in the late 80s, early 90s when we didn't screen blood very well, then that could get transmitted through the blood. It's all through bloodborne and opening in the membranes. That's how they get that. So, but once the viruses are in the liver, then the hepatitis in all those cases acts the same. It's just that the cause is different. There's these different strains. However, a couple things I want to point out before we go into some of the detail here. Hepatitis G virus, I'm looking on page 1365. You will not need to know about that. That's still controversial. Nobody is even 100% certain that that's like a real thing yet. It's just sort of speculation, so don't spend a lot of time on that. And the thing about hepatitis D is it can only be present if, like with hepatitis B. Hepatitis D will never be on its own, but somebody who has B may also have, this form of D. So D and G, we're not going to spend a lot of time talking about. Okay, now flip back over to page 1358. This table 49.4 at the top of page 1359. Sorry. This will be your friend. You do kind of need to know this table. And I already told you most about it, like the fecal oral you can see is A and E, and how a person gets it, the causes of it. So spend some time looking at that. The thing with hepatitis is some people never really know that they have it, and other people's symptoms are so bad and severe that it is absolutely debilitating, and it can be fatal, especially in people that have comorbid diseases or don't get good treatment for it. The thing with hepatitis, and for you as a nurse, when you are taking care of somebody with hepatitis, you just have to use standard precautions. You don't have to go, they don't have to be in an isolated room or anything like that. You just have to use standard precautions, glove, and if you're going to be around bodily fluids, if it's going to splash on you, then maybe a gown and a mask, but normally just standard precautions is fine. However, they do recommend, because you guys are healthcare, that you get the immunization. There are some immunizations for some of them, like Hep B. Hepatitis B does have an immunization, and it is recommended for you guys. I'm guessing you've all already been immunized for it. They are giving babies immunizations for it now. That's kind of routine to give the H-big, the HIG thing that they give the babies now. But you guys, it is recommended that you get the hepatitis B vaccine, just because you're in a high risk profession taking care of people that have Hep B. It is, hepatitis is not that uncommon. There's a ton of people that have it. The thing that you want to do as a nurse is obviously to prevent it from popping up in the first place. So review chart 49.7 so that you know some different ways to teach the patients and the community how to prevent hepatitis. A, B, and C. The dietary management of hepatitis, they do need lots of protein. Protein is really good for healing. Small, frequent meals throughout the day. A lot of rest. These patients really need to just decrease their metabolism, just to chill out, just relax and rest. So, sometimes bed rest, if they're really acute, is necessary. Obviously, you want them to abstain from alcohol. And chart 49.9 tells you some risk factors about hepatitis B. We talked a little bit about that already. And I wanted to draw your attention to the sort of the bottom half on page 1362, where it's talking about the assessment and diagnostic findings. I want to point this out to you because you might see it sometimes, and it will come up in the labs, and then that way you'll know what's being talked about. You have antigens, which is the cause of something, and an antibody, which is the reaction to the cause. So you can figure out what you're looking at when you're looking at these assessment and diagnostic findings. So see that first bullet point where it says HBCAG? That means hepatitis B core antigen. And by core, it means like in the cell, you have like the core, and on the surface, and an E, which is kind of like, I think of it as like early. It shows up early in the course of the disease process. So if you're seeing, and this is true with hepatitis C or E or A, the same antigens will show up, just the different letter. So like this could say like hepatitis C core antigen, like that. So that's how they can tell if the patient has an antigen, and then each of the antigens has a very specific antibody that tries to fight it off. And if you look down at the next bullet point, you can see where it says anti-hepatitis B core, and that means that that the body is fighting against that specific antigen, and the antigens and the antibodies show up at different stages of the illness. You don't need to go into that kind of detail, but I just wanted to point out to you, like, core surface and E, which is kind of like this floating independent protein thing out there, but I think of it as like early, because that one shows up kind of early in the game. So anyways, I just wanted to point that out to you. You're not going to be asked to know which one shows up at which stage, but you need to know that as a nurse, just to be kind of familiar with it. So then the most important thing with the hepatitis is how to prevent it. So if it's fecal oral, we're going to do good hand washing. We're not going to, you don't share glasses with, people that you don't know. You make sure that the food is well prepared, that hands are washed after using the restroom and things like that. And with the B's and the C's, you make sure to not share needles. There are like clean needle sharing programs now, which seems counterintuitive, but if somebody's going to be an IV drug abuser, it's better for them to be an IV drug abuser without hepatitis than be an IV drug abuser and spread hepatitis around, because everybody's sharing needles. So if you do get, if you're taking care of a patient who has hepatitis B and you get a needle stick, then you go get an immunoglobulin shot, which is offers some passive immunity while your body is building up active immunities so that you can fight that off. There are, like I was saying, some treatments now, some antivirals. A really good one for hepatitis B that is showing some success is alpha interferon. And it talks about that under the medical management on the bottom of 1363. Alpha interferon is a pretty good drug that is either taken once daily or a higher dose several times a week. And it is showing that it's, that's pretty good at reducing the duration and the severity of hepatitis B. Okay. What else do I want you to know about the hepatitis? Hepatitis C is very similar to B in the way that it's transmitted, in the way that it's treated. Same thing with what was that? I totally lost my train of thought. I don't know what I was going to say. Oh, yeah, high-risk sexual behavior. Because it's a blood-borne thing through bodily secretions, you can get that. Let's see. Yeah, again, and all of the hepatitis, you need to avoid alcohol and liver toxic medications like Tylenol. Tylenol is horrible for the liver. Okay, and there are some drugs with this one too. They have the antivirals. The ribavirin and peg interferon are pretty good for hep C. Yeah, so kind of look through there. The rest of these you don't need to know. There are some non-viral hepatitises that can show up. So if the patient is looking like they have hepatitis and you've tested them for hepatitis, like those I just showed you, the anti-hepatitis C antigen or whatever, and those are all negative, you have to look for non-viral causes, and some of them can be some of the over-the-counter drugs. So if somebody's been taking huge amounts of Tylenol, that can cause hepatitis. So if somebody is using over-the-counter medications, it is really important that you're teaching them to just use the medications as prescribed on the back. You see this a lot where, one works great, so why not take 10? Well, lay people don't understand there's some side effects, even if it's just an over-the-counter medication. So sometimes in those cases, you can treat the liver with corticosteroids and stuff like that. Okay, fulminant hepatic failure is just when It's like end stage liver disease where the patient is probably not going to make it. Okay, so now let's do cirrhosis. So I'm going to turn this off so you can just focus on hepatitis, and then we'll do the next section on cirrhosis and maybe some cancer. Okay, I'll be right back.